8 minutes. That's the amount of time we give a patient when they leave the hospital. 8 minutes to understand everything you need to know to have a safe recovery at home. Understanding your new medications, what to look for in case of an emergency, when to make your next doctor's visit, where to find help. Think about that. Think about this is how we send our loved ones home every day. Over 100 million people are admitted to the hospital every year. And if they're lucky, someone spends 8 minutes with them and sends them home with this. The results? $315 billion in wasted healthcare dollars. 62% of patients never make their follow-up doctor's visits. 75% of patients don't understand their medication instructions. And there are serious consequences. 342 people die every day because they can't understand those instructions. Today, we are changing this. My name is Shira Bell, CEO and founder of CareTicker, and this is Sandeep Sood, our CTO. And I'm here today because when I first started my last healthcare company and sold it in 2008, I still couldn't believe there was this massive problem permeating the healthcare system. So I decided to lean in again and fundamentally disrupt this chaotic, inefficient process. Imagine if there was a magical platform that took all of the things, the tasks, the reminders, the coordination of doctor's visits, the filling of prescriptions, the purchasing of things, everything necessary for recovery, and seamlessly turn them into applications for any hospital procedure. That is CareTicker. And today, we'd like to show you just one application built on our platform, Knocked Up. Marissa just found out she's pregnant. Ecstatic, she and her husband tell a few of their close friends the good news and schedule their physician's appointment. Can we go to the phone, please? Go ahead. At her physician's appointment, her doctor gives her a prescription for Knocked Up to help her manage her pregnancy and her admission to the hospital. On her way home, Marissa downloads the application and enters her due date. Immediately, Knocked Up creates a customized set of checklists and reminders for Marissa to follow. Because we all know doing our own to-do list, our own tasks, all of that, most of us fail miserably at it. Knocked Up does the work for you. We have built an intuitive platform that not only sets the reminders, but also creates the dates and times of those reminders that are based on the nature of the task involved. For example, Take Infant CPR class occurs every Thursday at 1 p.m. Schedule a first pediatrician appointment occurs every Monday at 9 a.m. Knowing that she needs the support of her doctor, her family, and friends, Marissa can also seamlessly add them as members of her PIC crew to provide support and monitor her preparation progress. Adding your husband at this time is a good time because he can help assisting in the preparation of things. And you'll see Marissa has completed almost 63% of the tasks involved. It's now early October, and Marissa's in labor. She's excited at the hospital, and she wants to notify everyone that she's there. So she opens up her Knocked Up application, finds the hospital she's at, and she checks in. In one simple click, everyone, even her physician, gets a text message saying that they're at the hospital. The next day, a tired mom uploads a beautiful picture of her baby to Facebook and is ready to go home. On her way home, she uses Knocked Up again to check out. This time, she's notifying her PIC crew, hey, I need your support. I'm going home ready for recovery. Now, the hard work begins. Once home, Marissa uses her Knocked Up checklist to cross off a few more to-dos. She also is getting these reminders that she hasn't completed her follow-up OB appointment. So she pulls up her physician in the Knocked Up provider directory, confirms her insurance, and schedules her appointment. We have aggregated over 3 million provider profiles of physicians, pharmacies, rehab facilities, so that patients can easily plan and coordinate post-discharge care. Can we go to the slide, please?
back to the presentation.
So now imagine CareTicker applications for every hospital procedure. We are scaling our platform and building applications for orthopedic, chronic disease, and diabetes. We have also leveraged the application and beta testing our second application for orthopedics. We are the only application in the iTunes Store today that is currently being prescribed by physicians. One of our partners, the Institute for Women's Health, serves over 97,000 patients a year. Every single one of them gets a prescription for Knocked Up. We have also forged partnerships with the largest manufacturer of prenatal vitamins. Now that CareTicker checklist becomes transactional. CareTicker will be at the center of every transaction, every time a patient's discharged from the hospital, and will capture a percentage of that $500 billion market. And look what we've done to those 8 minutes. The patient goes home, not dazed and confused, the family and support systems in place, all through a simple checklist on your phone. And don't you think those 100 million people deserve it? CareTicker, about time. Thank you.
I think this is great. I wish I had this all those times I went out of the hospital. Sort of the information you have, is that kind of your database? Is that tied into the hospitals or the caretakers' data systems? How do you sort of integrate that?
So we are staying away from integration into the hospital systems and the providers, and it's very specifically why we're staying away from that. We see a lot of companies kind of fail and burn through a lot of cash in doing that. We are very focused on simple coordination with the consumers. Now, we will be down the line integrating in the post-acute provider side, but not focused on integration with the hospitals yet. Did you have a question on the provider database?
No, I think that's great. I think it's really hard to integrate with the hospitals.
Nope. It's a long sales cycle, 24 months. No.
So
they're not very innovative.
So you're focusing on the key, sort of, the 5 or 6 main sort of elements that you were.
So we're covering the platform of applications represents over 60% of all the admissions into hospitals. So we're very focused on that, very procedure-based, and really working with the physicians in each of those specialties and developing the checklist protocols as well.
So what's the main value proposition? So if I can use Orchestra and Wunderlist to manage my tasks, I can go to Foursquare to check in, I can go to Facebook to share my photos. You're not integrating with the hospitals. So is it just the convenience of bringing all that together in one, or is there another value proposition other than these other kind of services?
To the patient?
Correct.
So the value proposition to the patient right now is that when they leave the hospital, they just get a stack of papers. And most patients never prepare for what they need before they go into the hospital in instances that you can. So imagine now, instead of getting that stack of patients when they're leaving the hospital, they already have the app on their phone, they already know what to do and how to coordinate it and access to those services that can help them.
How important do you think it is to get buy-in from the doctors, and how accessible is that without having the endorsement from the hospital? What's the
buy-in, so we were very focused on the buy-in from the physicians for 2 key reasons. One, what we found is the physician giving the script to the patient carries a significant amount of credibility, and so the patient engagement is much longer. Patients are going to, really, my doctor gave me this, they're listening to that. And the other interesting thing that we learned with physicians is that at first I was scared, oh my God, they're going to not want us in there, but they embraced it for a number of reasons. One is because their patient's more engaged, and their reimbursement is going to be changing. So physicians' reimbursement is now going to be tied to those patient outcomes. So they're very excited about it, and they're asking to participate in developing the checklist.
What do you do to get credibility with the doctors so they understand that your protocol is consistent with the protocol they would subscribe, or how they would?
Well, physicians have struggled with this for a long time. Right now there isn't a national protocol for just discharge planning according by procedure. And so when I sit down with them, it takes the work away from them. So instead of them getting the phone calls, their staff is not getting the phone calls of what to do, and they're involved in it. So they're just excited that there's something that's taking the time away. They can focus more on the patients. A great
How do you make
question. Who
money?
pays for it? I love that question. So we actually have 3 key revenue streams. One is when you look at the post-discharge planning, the services usually are wrapped around home care, caregiving, DME equipment, and pharmacy. So when you look at the monetization for pushing, kind of a provider bidder platform, if you will, right now that model is very broken and it's very incestuous in healthcare. So we're going to be disrupting that significantly and taking a cut of that just on a referral fee. And then interestingly enough, we're working with brands because brands are not engaging with that patient. Think at that point of discharge, they're just leaving them on the table where they could, I want that person to fill my scripts at CVS, but I also want them to buy the crush they want, the candies they need to feel better, and the creams, and bundle it together. So we'll make money that way too.
So personal productivity apps are really tough to scale. They're really, and so I think that, and you haven't mentioned anything there's some social components built in, but I think that I haven't heard you talk about how you're going to help. If I'm pregnant, I've got a problem, need help from other pregnant mothers, how am I going to socialize with them? And so because you haven't added that into the mix, I keep thinking this is like a meaningful, but it's not a very big opportunity. So how do you get big? How do you get big? It's tough to reach all these people cheaply. How do you get big without being social, unless you're going to talk about being social right now?
Great question. So we didn't want to do social just to do social, but we obviously have plans in our roadmap around, imagine this scenario. So instead of most of the health support groups right now are really after the fact. So I had hip surgery last week, and now there's someone who's going to have hip surgery, and so, what did you do? Imagine now with the data that we have, I know every time someone is checked in for hip surgery. Now I know every person, let's take Florida for example. I know every person in the state of Florida who's checked out yesterday had hip surgery. Now what we do is we take that data and we can aggregate and follow what therapies did they use. Can you, bundle some of the services that they need, and then they can share, well, I did therapy 3 days a week versus someone else doing 4 days a week. So that's very, very big in healthcare, is leveraging that patient data. But we just, really strategically wanted to understand the distribution with the physicians first, and then understand the engagement, and then build the social platform thereafter. But there's big plans for that.
So we're out of time, but thank you very much, CareTicker. It's a great job.
Thank you.